What will I gain from this video? After watching this video, you'll know how radiologists divide and classify the mediastinum and what anatomical structures lie within the mediastinum. The mediastinum is the region of the thorax that lies between the two lungs. On the PA film, this is represented by the white area seen centrally. On the lateral projection, the mediastinum extends from the anterior thorax to the posterior thorax and extends superiorly and inferiorly for the entire extent of the thorax. When we talk about the mediastinum, we usually talk about the anterior, middle, and posterior compartments. When we look at the position of this lesion on this lateral X-ray, depending on which classification of the mediastinum we use, this lesion could lie within the anterior mediastinum, could lie within the middle mediastinum, or could lie within the posterior mediastinum. This is a source of considerable confusion. I recommend the use of Felson's classification. Felson was a radiologist and a very practical radiologist, and he classified the mediastinum based on the use of two lines. The first line lies along the anterior aspect of the trachea and the posterior pericardium. Everything anterior to this line lies within the anterior mediastinum. Felson's second line lies along the course of the vertebral bodies and takes the shape of the contour of the vertebral bodies. The line is drawn 1 centimeter posterior from the anterior edge of the vertebral bodies. Everything posterior to this line, by Felson's classification, lies within the posterior mediastinum, and everything between the two lines lies within the middle mediastinum. You can also add an additional horizontal line to Felson's classification at the level of the angle of the sternum or the fourth thoracic vertebral body. Everything superior to this line lies within the superior mediastinum, and everything below this line lies within the inferior mediastinum. If we compare now Felson's classification with the classic anatomical classification, we see that there is a big difference. Here we see the anterior mediastinum is lying anterior to the anterior pericardium. What are the anatomical structures that lie within the anterior mediastinum? Within the anterior mediastinum, we have the thymus, we have blood vessels, we have lymph nodes, we have nerves, and we have fat. Within the middle mediastinum, we have the esophagus, we have the tracheobronchial tree, we have blood vessels, we have the aorta, the superior vena cava and the inferior vena cava. We also have lymph nodes, nerves, and fat. Within the posterior mediastinum, we have vessels, we have lymph nodes, we have fat, but we also have nerves. We have the sympathetic chain, and we have the intercostal nerves. The aorta lies within the mediastinum. It has an ascending portion, aortic arch, and it has a descending portion. The geometric shape of the aorta is roughly similar to a candy cane, both on the PA and on the lateral X-ray. On the chest X-ray examination, the ascending aorta is usually not identified because it does not form an interface with the lungs. The aortic arch and the descending aorta, however, do have contact with the lung and can be identified on X-ray examination. The medial aspect of the descending aorta, however, is usually not identifiable. On the lateral X-ray, we can usually identify portions of the aortic arch and descending aorta because of their contact with lung. The aorta forms an arch as it extends from anterior to posterior, and in distinction from the little arch of the left pulmonary artery, we call this the big arch. The superior vena cava lies within the superior aspect of the mediastinum and is formed by the joining of the brachiocephalic veins. On the chest X-ray, we'll identify the right edge of the superior vena cava as it forms an interface with the right lung. We will not see the medial border of the superior vena cava. It's important here to note that the superior vena cava forms a straight vertical edge. Also important to understand where the superior vena cava lies on the lateral X-ray. If we look at the CT examination, we can identify the superior vena cava lying anterior to the carina and the right mainstem bronchus. The superior vena cava also lies anterior to the right pulmonary artery. On the lateral X-ray, we can identify the trachea, we can identify the right pulmonary artery. We can now predict that the course of the superior vena cava would be from superior to inferior, anterior to these structures. Here is an example of a central line that has been placed into the right atrium. The course of this line is anterior to the trachea and anterior to the right pulmonary artery, and we can confirm that the position on the lateral X-ray is normal. The esophagus lies within the mediastinum centrally and extends from the oral cavity to the stomach inferiorly. The medial aspect of the esophagus on the right side forms an interface with the right lung and can create a border within the mediastinum. This border is called the azygoesophageal recess. The azygoesophageal recess is clearly seen as an edge, and the esophagus is causing the vertebral body on the left to appear wider than the vertebral body on the right. Lymph nodes are present throughout the mediastinum, through all compartments. On this CT examination, we can identify numerous lymph nodes that contain calcifications. When we look at the PA X-ray, these calcified lymph nodes would account for the numerous additional white densities that we have throughout the mediastinum that we do not see on normal examinations. So in summary, use Felson's two-line classification, add the superior line, remember the anatomy in each compartment.